This is Chadi Alraies coming to you from NCVH 2025. I'm really privileged to be with Claude Minor to talk about a very important topic, which is prior authorization. So Dr. Minor is a physician. He worked for a brief time for the insurance, but now he started a new initiative. We'll talk about it. Dr. Minor, thanks for being with us.
Well, thank you. Thank you for having me. My initiative is basically this. I think physicians are so busy when they're dealing with insurance companies, they don't understand the information they need. When they get a denial, they don't understand how to pursue that denial. The insurance companies base a lot of their approvals on evidence-based medicine. Just like we as physicians practice, the insurance companies often have medical directors that are quite knowledgeable. And often what ends up happening is that the physician doesn't understand the information that they are looking for in order to appeal the denial, move the denial forward, or turn it into approval, nor does their staff actually understand. So I feel my job, having the knowledge that I have, is to actually go into the physician's practice and educate his staff, including nurse practitioners and PAs, who are also providers, so that they can supply the information that is needed, because the physician doesn't really have time to sit and deal with an insurance company for an hour or more. And more importantly than that, if his staff hasn't supplied him with the information he needs, it's just not going to be successful. Absolutely. So that's what we specialize in doing. And I think if I can bridge that gap to some extent and make physicians understand that, there will be less burnout and they can use their time more wisely.
And usually from your experience with this new initiative, you have one-time visit with the office or you have multiple sessions with them?
The way I do it is I'll come in, usually I'll tell the physician, let's do this on the weekend when your staff is less busy, and I'll present them with information and data and that sort of thing and make them understand what evidence-based medicine is all about and what needs to be documented. The most important thing I do is teach the physician what he needs to document, because they say if it's not documented, you didn't do it, and if you have a denial, you can't turn it into an approval without the appropriate documentation. So if the physician gets that information in front of his hand and it goes to a peer-to-peer, he's got all the information he needs. The second most important thing is kind of like the serenity prayer. Understand what you can't change. The denials that you can't change, you let those go and you move to the ones you can. Right now, there's a blanket effort on the physicians in the office to try to address every denial. You can't do that because some of the denials are appropriate. So you try to figure out the ones that you can address, that you can overturn. There's an art to having a conversation with your fellow colleague. It does you no good to demean the physician on the other end because he's not practicing medicine, to tell him you know more than he knows. Yeah. They are simply looking for information, and if you could supply them with the appropriate information, then you could turn that denial into an approval.
You're right. I mean, I'm a cardiologist, and I was talking to somebody on peer-to-peer. His background is immunology.
Right.
It's a completely different language, so I have to break it down.
Yeah, your job is to educate that physician and say, here's why this is the way it is, and the evidence-based medicine says this. And if you give them the facts and the evidence-based medicine, then you could turn that denial into an approval. The other things often is there are things that happen. If you're a proceduralist, there are certain things that happen during the procedure that may not be reflected in the medical records, and only you can tell that physician on the other end of the phone, well, you know what? This patient had a BMI of 55 and it took me 20 minutes to get access. That's something only you can tell the physician on the other end of the phone, and he's going to say, 55, I sympathize with you. Yeah, I think that's complicated. I think we ought to convert that to inpatient. Your staff can't tell him that.
You can, absolutely.
So it's important.
Yeah, from your experience and over the course of years that you have been doing this, success rate improved, what is the rate of satisfaction? How do you grade your impact of this initiative on the practice?
Well, the simple way I grade my impact, I say to the physician, if you're happy with this arrangement and you're happy with what we've done, we will continue this. In a lot of cases, the physician has the option of just me coming in for a weekend and explaining things, all the way to the option, if he wants to, he could designate me to do his peer-to-peers for him. And we are early in this process, but so far what I found is that the physicians are happy, and many of the physicians just don't want to do peer-to-peers. So they're very interested in designating me to do this, and you can do that.
So it's a spectrum of services you
provide? Right, it's a spectrum of services that we offer.
Education versus everything.
Right, correct. From education of the staff, to all the way to actually getting involved and helping to move forward the process. And when it comes to interacting, when it gets to the level of physician to physician, we can do that interaction for you.
Absolutely. Well, thank you so much for a great initiative, Dr. Minor. This is really, I never heard this service before.
Yes, this is brand new. It's something that I felt needs to happen in order for physicians to be able to do what they need to do.
And they will leave their contact, or at least the company, there's a company link for their website.
Yes, the company is called Medical Appeals. Our website will be up soon, and we're continuing to work. If you need to get in touch with me, you can find me on the web. The best way to reach me is my phone number, 318-557-9771, and I'll be happy to have a discussion with you.
Thank you so much.
Thank you, sir.
For your time. And for our audience, thank you for watching us and watch the videos and other on NCVH YouTube channel. This is Chadi Alraies coming to you from NCVH 2025 in your days. Dr. Minor, thanks again.
Thank you.
Thank you.